Thanks for joining me in Mrs. Lavoie's classroom. Just a reminder, the ABA tips and tricks I share here are for educational use only and are not a replacement for professional behavioral services. Always consult with your own BCBA or healthcare provider for personalized advice. Let's get started. Hi everyone, and welcome back to Mrs. Lavoie's classroom. If you've ever felt like you're playing a game of whack-a-mole with a child's behavior, stopping one thing only for another one to pop up, you are not alone. Usually when a child acts out, our first instinct is to say, "Stop doing that." But here's the secret. Behavior happens for a reason. If we take away a behavior without giving the child a new way to get what they want or need, the old behavior will come back right away. Today, we are talking about alternative and replacement behaviors. We'll break down what they are and how you can use them today at home or in your classroom. Before we pick a new behavior, we have to look at the function. Think of behavior as a tool. Is the child trying to get something like a toy or attention, or escape something like math work or a loud room? Once we know why they are doing it, we can find a better tool for them to use. For more information regarding functions of behavior, check out my video called The Big Four. A replacement behavior is the most direct fix. It serves the exact same purpose as the inappropriate behavior, but it's socially acceptable. So let's take a look at it. If you have a student who hits a peer to get them to move out of the way, that's a problem. The function of their behavior might be escape, getting the peer out of their space. But the replacement behavior we would teach would be teaching the student to say, "Move, please," or how to use a hand gesture, which indicates "excuse me." Why it works. It's a one-for-one trade. The child still gets what they want, but in a way that doesn't hurt anyone. Pro tip. The replacement behavior must be easier or faster than the old behavior. If it's too hard to do, they'll go back to hitting. Now, alternative behaviors are a little different, as these behaviors cannot be done at the same time as the unwanted or inappropriate behavior. So here's some examples. Let's say your child constantly shouts out during movies or a show. The alternative behavior is giving the child a chewy snack. Or let's say you have a student who often pushes peers when in line. The alternative behavior is give them a class job, such as holding an item that requires two hands. If their mouth is busy chewing, they physically can't shout out. If their hands are full because they're holding something, they can't push. Here is a quick cheat sheet you can screenshot to remember the difference between replacement behaviors and alternative behaviors. Changing behavior takes time and a lot of practice. But when we focus on what a child should do instead of just what they shouldn't, we set them up for success. Thanks for watching. For more ABA insights, make sure to subscribe and follow. See you next time.